If it was somehow possible, couldn't I just take hair from another person and transplant it? That's the question I was asked. What about a hair transplant from a family member? Hello, I'm Lee Seung-jun, Chief Director at Modumo Clinic. This was a question I heard recently during a consultation. Doctor, my hair loss is so severe that I don't have enough hair to harvest from my own head. If it's at all possible, couldn't I just get a hair transplant using someone else's hair? That was the question I was asked. Now, this question itself might sound like a jest, but the patient posed it to me with a rather earnest and serious expression on their face. So today, from the perspective of a hair transplantation expert, I will discuss whether it is truly possible to transplant hair from another individual. I'll give you the conclusion first. Theoretically, it's not zero, not impossible. However, in reality, you can consider it to be practically almost impossible. The reason for this has nothing to do with the surgical method itself. Of course, the surgery itself is technically feasible, but our bodies naturally possess an immune system, which is fundamentally designed to reject anything that is not inherently its own. And that is precisely why it's impossible. Hair transplantation isn't simply a process of harvesting hair and then just implanting it in the front of your head. It's a type of tissue transplantation that moves living hair follicles. You know, people with skin or ligament damage often undergo skin tissue transplantation in plastic surgery. Similarly, hair transplantation is also a form of tissue transplantation. So, the most critical question isn't whether someone else's hair can be implanted, but rather if these transplanted hair follicles can consistently endure and thrive. That is indeed the most vital aspect of the whole process. However, this is where a problem begins to emerge. Due to our body's immune system, when foreign tissues are implanted, most of them simply cannot survive. Our body's immune system has this mechanism for distinguishing between what's ours and what's foreign. And what's crucial in that process is HLA, human leukocyte antigen, which plays a really important role. Let me break it down for you simply. Think of it as a lock and key system. Our body's white blood cells, they are part of our immune system. Each carry around a lock. Actually, it's not just one lock, there are several. Our white blood cells carry these locks, and conversely, every single cell, tissue, and organ within our bodies carries a distinct key of its own. And as the immune system components flow through the blood and lymph vessels, they occasionally try to fit a key into a lock. When that key is inserted and it matches, it's a pass. Then no immune reaction occurs. However, if the key doesn't fit, if it doesn't match at all, an immune reaction will immediately be triggered. Then, our body's white blood cells, the immune cells, will essentially attack and consume those cells. That cell will die, so the immune system is really complex once you get into the specifics. I remember finding immunology very difficult back in medical school. Thus, in organ or tissue transplantation, when placing another's organ into your body, the most crucial factor is the HLA previously mentioned. There are two main types of HLA, Class 1 and Class 2. You can think of it as two types of keys and two types of locks. The immune system carries around these two locks and constantly tries to match them with keys. If there's no match, an immune reaction occurs. Now, this inevitably leads to a follow-up question. People often ask, we frequently encounter individuals who undergo organ transplants, kidney, liver, lung, and heart transplants. How exactly is that feasible? Ultimately, individuals who undergo organ transplantation take immunosuppressants long-term after the procedure. In fact, you can assume they take it for the rest of their lives. This immunosuppressant drug is what neutralizes that lock and key system. In other words, they essentially take a drug for life that lowers their immune system to prevent an immune rejection reaction from happening. But immunosuppressants, importantly as the name implies, actually lower immunity. Our body's immune system is incredibly important. When viruses or bacteria enter from outside, our body's immune system takes on the role of defeating these pathogens. However, because this immune system is generally suppressed, our bodies themselves become quite vulnerable to infection. For instance, if we catch a cold, we cough and have a runny nose for about 3 or 4 days, then usually recover. But for people taking immunosuppressants, even a simple cold can, in severe cases, lead to pneumonia and its complications. Thus, as a medical resident at the university hospital, I frequently saw patients on long-term immunosuppressants after organ transplants. They'd be admitted for a cold, only for it to escalate to pneumonia, leading to month-long hospitalizations. That's why for people taking immunosuppressants after an organ transplant, regular checkups are essential. They have to get blood tests every 6 months and be very strict with their lifestyle management to avoid infectious diseases. However, to simply accept and endure such a burdensome situation for your entire life, just for the sake of one's hair, from both a realistic and medical perspective, I simply don't believe it's right. Theoretically, transplanting someone else's hair isn't utterly impossible. However, considering these practical circumstances, you can virtually see that it's just not viable. Then the next question comes up, what about hair transplantation among family members? People ask what would happen if they received hair from their father, a sibling, or another relative. But even within the same family, the HLA types will be different. So if you check the organ transplant waiting lists, even if family wants to donate, they can't if their HLA doesn't match. Thus, it's quite common for individuals needing a kidney to spend a year or two on an organ transplant list, awaiting a compatible organ. And actually, when I go to World Hair Transplantation conferences, this is called allogeneic transplantation. Cases where hair from another person from the same species, a human, has been transplanted are sometimes presented. There are only 2 or 3 such cases a year, and if you look at their history, most are patients who have already had an organ transplant. They've received liver, heart, or lung transplants, taking immunosuppressants for life. For these specific patients, hair transplantations are occasionally performed globally, but as of now, there have been no reported allogeneic hair transplantations in Korea. So, there are no doctors performing this procedure. Patients who require organ transplants like a liver or heart are those whose very lives are intertwined with the surgery, making it nearly impossible for them to survive without it. For those experiencing hair loss, it's not a direct matter of life and death. Rather, you can view it as primarily a cosmetic concern. Thus, you must consider if it's truly worth enduring a lifetime of immunosuppressant drugs and all the difficulties that come with them, solely for this singular cosmetic reason. That's essentially what transplanting another person's hair entails. So, in conclusion, hair transplantation doesn't create new hair. Hair transplantation is the process of harvesting healthy hair from the back and sides of the head and then relocating it. So, what's most important isn't how much you transplant or how you do it, but ensuring the transplanted hair follicles survive. If you receive hair from someone else, this survival process is very difficult. It's a very challenging process. Alright, let me summarize. Medically speaking, a hair transplantation from another person isn't impossible, not a zero chance. However, considering the practical circumstances, it can be seen as virtually impossible. That's because immune systems, like the HLA, must match, and finding someone with a match is extremely difficult. Thus, you should understand that hair transplantation from another person is considered impossible. Should you have any further questions, please leave them in the comments below this video, and I'll be happy to assist you with the answers. This has been Lee Seung-jun, Chief Director of Modumo Clinic. Thank you.